Good evening and thank you for joining us again. Last week, Friday, we had a fantastic session between Dr. Bruwer and myself where we spoke through why I wasn't vaccinated. We spoke about the treatment options that are needed. We spoke a lot about vaccines. And there were also a lot of questions on our Facebook page. So we've gone back to our Facebook users and we've told them they can send us the questions that weren't answered and any other new questions. And we've now taken all of those questions and we realized many of these questions had to do with mental health and anxiety. A lot of them had to do with the state hospitals and a lot of them were follow-up questions to Dr. Bruwer. And that's how we've now constituted this panel. And I'm the least qualified on this panel. And maybe once I've done the introductions, you'll realize why I say that. Because on my right, I've got Dr. Belinda Bruwer, who's a specialist psychiatrist. And I've got Dr. Hamunyela, who's also a specialist psychiatrist and works for the state. I've got Dr. Bruwer again, who many of you by now know is a specialist physician and a pulmonologist. And then I've also got Dr. Ellitson, who is he calls himself a medical officer, but he's a lot more than that, and he's also a state medical doctor. So between the four of them and the few questions that are going to be directed at me, this is our next session of the FLON conversation. The format that will follow is Blanche Goroses from the NBC will be directing the questions. If any of you have questions that you want to ask, please go onto the Facebook page of the First Lady of the Republic of Namibia, put that question there, and we'll try to make sure that this panel asks the question. There have also been a lot of answers given by the Ministry of Health, which are official answers, which we'll also be going through around what kind of vaccines are we looking at in the future, and some of the procedures that are done at the testing centers. So I think, Blanche, you can really start with the questions that we've taken from our platforms.
Well, thank you, Madam First Lady, and there are quite a mouthful here. And around the vaccines, some of the questions are, if the vaccine is safe, why do people need to sign a consent form? I think you can take that. And then why is the death rate going up now that people have started to take the vaccine and they were not dying in big numbers last year, for example? Why do we all need to go for a vaccine? Can't we just wait for herd immunity? These are just some of the questions being posted here. And do I need to vaccinate after contracting COVID? And if so, how long must I wait? So these are some of the questions. I think Dr. Bruwer and yourself as the medical officer can take some of the questions around the vaccines.
So thank you very much for your question. So we'll take the question in parts. So just as to the concern regarding why we need consent for the vaccine, for any therapeutic intervention, I think everybody would need to have informed consent. So I think that is the main concern that we have with regards to the procedure, the intervention that's being given. And in this regard, it is the coronavirus vaccine. So it's nothing special, nothing extraordinary. It's just that we need informed consent. And with regards to why the death rate is currently going up, I think it's very important for us to say that initially our responsiveness to the vaccine was very, very poor. So it's very difficult for us to correlate the vaccine to the increasing numbers of deaths. It's probably more appropriate to say that people really haven't been responsive enough to the vaccine, and the community transmission of the virus has actually been taking its effect as we expected.
And if I can add to that, the death rate, and you can correct me, is probably correlated to the number of infections. And because we have higher infections, we have higher death rates. And that's why it's such a priority to get the infections down so that the death rate goes down.
Yes, absolutely. And I think also that speaks to this question about herd immunity. In order for us to gain herd immunity, we have to weigh the risks and the benefits to ourselves. So concerning getting herd immunity the natural way by acquiring a natural infection, as opposed to getting herd immunity by getting vaccinated. I think that is probably what we're sitting with and what we're dealing with. If we are going to watch and wait for herd immunity, we are going to sit with an unprecedented crisis, a humanitarian crisis in a manner of speaking.
Dr. Bruwer, I think you can take this one. I think it's a discussion that you had with the First Lady and to the President. The person is asked whether they can take the vaccine still after contracting the virus.
Yeah, sure. So the short answer is yes, you can. Currently, for the 2 vaccines that we have available in Namibia, the ministerial guidelines is that you can take it after 2 weeks after completion of your isolation period. There are some newer guidelines coming that some of the other vaccines you should probably wait about 4 weeks before taking it. But yes, the recommendation is absolutely to take the vaccine after having had the coronavirus, and that is purely to enhance your own immunity, your natural immunity, and to protect yourself from getting reinfected.
And just before I hand over to Madam First Lady, the last one would be: does Namibia have a fixed guideline on age recommendation per vaccine type?
So the current vaccines that we have available, all of them are only registered for adults, so 18 years and older. And there is no specific recommendation as to in that population which vaccine can go to which age group specifically. Maybe we can also just in this touch on the younger age group, because I think that is important. Some of the vaccines, Pfizer specifically, have been studied in the younger age group, sort of 12 years to 18 years of age, and they've found that to be a safe vaccine in that age group. We don't have Pfizer available in Namibia at this stage, but in future that might become available. And then in the age group younger than 12 years, there no study. Well, there's actually ongoing studies in that age group, 2 years to 12 years, but we don't have data available in that age group. So currently, of all the vaccines that's available, that age group cannot be vaccinated yet.
Madam Geingos, as I'm handing over to you, there is a question here directed to you. Why is the First Lady not taking the vaccines that are currently available in the country?
And once I've answered that, I think, Branch, let's go through the questions, each one as they are, because those are the ones that we hoovered from our social media pages. And I think people are waiting for those answers, unless I'm interfering with your process and you want to come back to them. Okay, so why have I not taken the vaccines available in the country? So this is, I think it's important to answer it again. The full answer is on our Friday. So if you go on our session with Dr. Bruwer on Friday, we answered this question in depth as to why I wasn't vaccinated, which likely led to the reason why we contracted COVID. So the question about why I haven't vaccinated yet, I think, is the question of how long do you vaccinate after you've contracted COVID? I think there's different guidelines. Some people are saying, some countries are following 2 weeks, some are following 3 months, and some are saying between 3 to 6 months. Personally, I'm very eager to get vaccinated, and I've set a date for the 29th of June that I would like to vaccinate with one of the vaccines that are in the country and is available to everybody. So I'm surprised by the question, because on Friday it was my intent to get vaccinated at a testing center with the vaccines that are available.
Okay, then. So we'll continue with the discussion and then come back to the questions.
Thanks, Blanche.
So the question, once vaccinated, do I need to adhere to public health regulations by continuing to wear a mask, social distance, and sanitize?
So in short, the answer is absolutely yes. Even in spite of the fact that the vaccines that we have available to us have such high efficacy numbers, I think it's important for us to realize that for every individual person, there is still that small risk that you may acquire the infection. All that it means is when you get exposed to the coronavirus, there's less likely there's less likelihood for you to acquire the infection. So I think, yes, in short, absolutely we should wear masks and sanitize.
Babies and children safe from COVID, and why can't they take the vaccine?
I think I answered that in the previous discussion. The current available vaccines in Namibia hasn't been tested in that age group, so we can't vaccinate them. As I said, some of the companies, some of the manufacturers with some of the other vaccines are trialing it in the younger population, not necessarily in the age group under 2 years yet, but in the sort of slightly older. But everybody is susceptible to COVID. Fortunately, the younger population tend not to have such severe disease and tend not to end up in hospital. So I think we're fortunate in that way. But we'll probably get to a point where younger children might qualify for vaccinations in the future.
I think the next question can be tackled by Dr. Bruwer and also yourself. A question on what is the impact of COVID-19 of vaccine on people undergoing hormonal treatment, including those who are undergoing gender transitions.
I cannot think that it will have any impact, except that it will cause you to have immunity against coronavirus, because the vaccine doesn't do anything else than you introduce the virus to the body's immune system, and it stimulates the immune system. So I also had questions about fertility and infertility. It really does not work on that level of the body, so it will not have an effect on the process that the patient is following. I think a bigger problem is the mental health issues associated with coronavirus and the pandemic, and that people really struggling with certain issues will have that amplified because of what we are going through at the moment. So they must please vaccinate as well. Yeah.
So that means it will not interfere with the prescriptions given by the doctors for hormonal?
Not at all.
And should I first take a COVID test to make sure that I don't have COVID before I vaccinate?
At the moment, the guidelines is not that you don't have to take a test before going for the vaccination. Obviously, if you're sick, if you've got symptoms, we don't recommend. Firstly, even if you have a flu, we don't recommend that you be vaccinated. But if you're totally asymptomatic, healthy, then there's no reason to go for the COVID test before going for the COVID vaccine.
And then the second part of the questions on vaccine is reasons for not taking the vaccine. Some people citing they are not taking the vaccine because they put their faith in the power of prayer. Question is, if I take the vaccine, will it look like I don't have enough faith? Doctor?
I think we would like to answer that from the perspective of mental health. Regardless of what a person believes in, all of us believe in a higher power above ourselves. Even if you say we believe only in prayer or in God, even God himself, when he was healing people, he was giving medicines and then praying. So we are saying that your faith and you yourself, your behavior is the determinant factor that will determine whether you are actually true believer in yourself. Are you abiding by the rules? There are regulations set in place. This is to decrease the number of the infection. But if you yourself, you are not adhering to it, then that is where we are transmitting the illness. So the behavior, then we are saying, even though it is said that we have to social distance and we have to wear masks, this is something new that we are introducing. And people are only doing it because it is the rule that is put up by His Excellency. But within yourself, they don't have that commitment to say, I am obeying by this because I have the determination. And you don't own that. If you own it, then obviously then we are saying that, yes, then we will decrease the number, and then even your faith, you can bring it in. But we are not saying that because you believe only in prayers, do not take the precautions and do not take the medication. You have to do all things at the same time.
If I can just add that, why then does this, or do churches feel that they are being targeted with these regulations?
I will not answer on behalf of the churches, but as an individual, you have to decide, am I believing in a person who is running this church, or are you believing in God? If you are saying, I'm doing this because my pastor is saying, or our church leader is saying, then definitely you're not believing in God. You are worshipping the image of a person. Then there you are failing God. So we are not supposed to use the name of God in place where it is not supposed to be. We say we have to be accountable and ask yourself, is this my faith, or is it the person that I'm worshipping? So if that person is not in that church, that means you have nothing that you are holding on to.
I must agree with this. Because I also know many pastors who have themselves been vaccinated, believe in vaccination, and encourage their congregation to get vaccinated. And the bottom line is this, Blanche. At this point, we do not put our faith in politicians, pastors. We put our faith in the evidence and the experts. So to me, we must decenter people who are not experts. That would include people like me, because I know there are people who listen to me, but I could be wrong. So the important part is here, people must do their own assessments, apply critical thinking, review the information themselves, and take the advice of experts and the evidence available.
And there's also a question, because I know this, since the rollout campaign, it has always been, is it voluntary, is it compulsory? That question around there. There are questions here asking, why should everyone get vaccinated? Is it not supposed to be voluntary? Let those who want to get the vaccine get vaccinated, and why is it being pushed down our throats?
So if I can answer on that. So the only way we are going to survive this pandemic and all the consequences that we are already bearing financially, socially, emotionally, educationally, I think a big principle will be altruism. We as a Namibian nation, we as a world, need to stop thinking only about ourselves and think, how can we together win this invisible enemy that we are facing? And part of that is vaccination. Part of that is the social distancing and the masking. I mean, it's really difficult with the elderly people sitting isolated in old age homes, but you do it because you love them. You don't want to infect your grandma. It's difficult with the children not being able to school. But I think altruism and being together as a nation, and stop thinking just about yourself and how you can protect the community by doing some of these things that the scientists, the frontline workers are begging people to do. That's the way forward, and not here and there everybody just voicing their own opinion.
So why then the feeling that the vaccinations are being pushed down the throats of the population?
I don't think we are pushing them or forcing people. The reason why I think people feel that we are forcing them is that, yes, government and the ministry is putting the adverts on the radios, on TV. This is only basically to inform the nation with evidence-based practice. When we are saying evidence-based practice, it's like you're using your own data that you are having in your own country within your population to say, okay, in my country, this much percent has been vaccinated. Now you compare it, obviously you have to compare it internationally to say how are you faring compared to other countries. Now, if we all refuse to take the vaccine, then that means Namibia is not compatible at all. And then that means we need to think of our own families. If you love your family, which we of course do you want to be the one responsible for their death? if you're not vaccinated, if you're not social distancing, it means you're going to infect the most vulnerable, the babies and your grandma and your grandfather. They will die, and then you have to deal with this grief and the guilt. And then mentally you are also not coping. And we're already not coping with people losing their loved ones. They don't have closure. But then if you are the one who's responsible, why not? All the vaccines in the world, when we were little, we were vaccinated. You know, and we managed to grow up healthy because of that vaccine. So the data used was from other countries, but because we also documenting to say 15 of us has been vaccinated today, give the different part. Is it female, male, age? Are you having comorbidities or what? And then you compare that. But if we are not doing that, then we are really failing our country and failing ourselves. So we need to do that. We need to take responsibility. We need to be accountable for our own lives. Don't think about other families, but start with your own family, and then you extend it to the other people. We need to love each other and care for each other.
And I want to expand on that with the concept of love protects, which is the basis of this whole campaign, because love does protect. You protect those you love as an individual, as a unit in your family, every single day for obvious reasons. But I think it's also the responsibility of any state to protect its people. Now, vaccines and COVID is not a Namibia-specific issue. It's a global pandemic. And we're seeing the scenes of how people are dying from COVID. We've seen what it looks like in India, in Brazil. We've also seen pictures of the UEFA Cups, where people in Europe are without masks. They're hugging each other. They're sitting on top of each other. And we also know in Switzerland, not a single person has been admitted in a hospital for COVID. And what was the solution there? It was vaccine. So imagine how irresponsible, how murderous it would be for a state to decide, I will not encourage people to vaccinate. I will not even buy vaccines. It's not necessary, because somehow we'll come to natural herd immunity. I think that would be the crime. So it's not about forcing it down anybody's throat. It's really about giving people the evidence of what we can get right, and we're not going to reach herd immunity. Sweden tried this. It didn't work. People died as a result of this. So if a country decides to use the best available evidence to save its people, it's not pushing down anything down anybody's throat. It's saving lives, because that's what vaccines do. It's saving lives. And beyond the love protects, if we don't vaccinate, another wave comes. With every wave comes new mutations. We cannot afford it from a mental health perspective. We don't have the financial resources. We don't have the healthcare workers who are resigning every day from our hospitals because they can't keep up. We don't have the money to pay for these vaccines all the time because they are expensive. And these mutations, some don't work against certain mutations. The economy can't afford this. So I was so happy when the governor of the Bank of Namibia said that economic policy is about vaccination. So there's so many things that rely on us accepting that we need to get vaccinated.
I just want to say, from the point of departure of a frontline worker, physically dealing with patients that suffer from coronavirus every day, it's not necessarily that it's your grandmother, and it's not necessarily that it's going to be somebody who has some form of an immunosuppression. We are dealing with young people like myself who are succumbing to this virus. So this is really, it's from the point of departure of caring for other people. It is an act of love, as we say. So I think we'd really like to encourage everyone to not think of it as something that's being coerced upon you, but as we are acting together to protect our family members.
Absolutely.
Yes. Can I just add a very important point he made? Doc said it's young people like them that are really leaving us at the moment. So we are saying it is also the same population that is refusing to take the vaccine. It's the same population that is social media wise, and therefore they read the wrong wrong information and spread it to people. And because they have a bigger population that reads, they follow that and they believe in the false information. So we are saying, even if you're reading or you're on the social media, decide, be very discreet in being able to say, this is the truth, this is not the truth. Be biological, scientific, to say, I am depending on facts, And the healthcare workers, honestly, they are suffering mentally. We are trying our best to do therapy. I'm on the psychosocial group for the ministry, and I also work private. But we cannot manage to support mentally the healthcare workers alone because of the huge amount of death that they are seeing every day. And then that means then also the psychosocial phone is available for the entire society. So they also call in. So it is also draining on you as a therapist and then the poor healthcare workers that are directly dealing with the COVID patients. So it is really important that we bring our part.
So what then happens when love not failing to protect, but then when it's questioned? And I think this is the next question is one that will have to be tackled by all the panelists. This person asking, my traditional leader, parent, friend, pastor doesn't believe in vaccine, and I decided to follow their example and not get vaccinated, as they say it's too risky. Maybe the First Lady can start.
I think I've already answered it, that we must all take our own decisions from experts, our pastors, our parents, our best friends, our peers, our employer, rich businessmen from the north who say it's a Bill Gates conspiracy. They are not experts. They are rich, they are pastors, that's what they are. They are not experts in this. So my advice is take your own advice, because when you're sitting on that hospital bed and Dr. Bruwer and Dr. Ellitson have to treat you, nobody else can help you. And just the last thing I'd like to say is we don't know each other. And we don't know of any global conspiracy being pushed by elites to force this on anybody. Or there's no motive, no financial or any other motive for us to be here lying to a nation of people as if, I don't know where, I don't know the logic that thinks that so many countries can coalesce to have this conspiracy theory, and so many of us can be part of this Illuminati, I don't know, this little demonic plot. I don't understand it, Blanche, why people would raise something like that. We come from different walks of life, and we are experiencing this virus from different perspectives. We've all seen the evidence.
Is it not because also a question here stating that vaccines were developed too fast within a year and are not deemed safe? Dr. Bruwer.
Maybe I should talk about that. Vaccines and vaccine development has been with us for many, many, many years. It's not a thing that started now. Coronavirus vaccine research started decades ago with the first SARS coronavirus that we had. If I'm not mistaken on the date, it's about 2003. And since then, research has been ongoing. I mean, and the vaccine development has been ongoing. With regards to the current vaccines, there were definitely no steps skipped in the development. It went through the phase 1, the phase 2, the phase 3 trials. I think what helped with the speed of development is the fact that it was a worldwide effort. There's a lot of collaboration between companies working together, universities, taking for instance the AstraZeneca vaccine. Oxford University teamed up with AstraZeneca to try and speed up the process, to make it more fluent, to develop these vaccines so that we can save the world, because that's ultimately what we wanted to do. And because of the pandemic, many companies jumped into this. So normally in medicine, drug development takes longer because it's one company. It does not want to share its data with anybody else because that company has to make a maximum profit from this. In this case, this was a worldwide pandemic, and the companies decided, listen, we can't go chasing profit. We have to collaborate. We have to try and speed the process up. But with regards to the steps in development, going through the phases, there was no shortcuts taken, and that brought us to the position where we know these vaccines are effective and we know they're safe, and that's what we wanted to have.
Yes, doctor.
With any scientific research, with any medicine, vaccination, any therapeutic development, there's very strict ethical guidelines to doing any research. So with these vaccines that did go through all the phases and are being used, there were many that did not make the cut because they got stuck in certain phases. So remember, as medical doctors, we have an oath, we have rigorous scientific training, we have to do good, help your patient. And at this moment, especially with patients following conspiracy theories, not wanting to look at scientific evidence and make a good decision, we are having doctors phone and asking for beds in the hospital, asking for oxygen, and there's none. So that's, for a frontline worker, a very difficult position to be in and not be able to help, not be able to give the care that your patient needs to survive. So I think people can really just look at the evidence, the way that we've been developing medicines and vaccines for over the years. Nothing was done differently except that the world worked together. If people wanted to, the whole theory about the 5G chip, people monitoring you, if you don't want that to be done, then put away your phone, because we know exactly, if people know where you are and where you're moving, what you're saying, because you carry your phone around. Why would they put it in a vaccine? Right.
Yeah. Yes, doctor.
With the vaccination, an important thing, a point that people are missing is that with you being vaccinated, it means that even if you are to contact or to get infected with the virus, you will get mild symptoms as opposed to the person who has not been vaccinated. So we are asking ourselves, would you rather wait for you to really get to a point where Dr. Bruwer is saying, where doctor is sitting next to you, you are waiting for the oxygen, or would you rather be on the safer side, having taken the vaccine and know that if you contract it, it will be a mild version and you just stay at home and then take the medication that the doctor is prescribing you?
Mm-hmm. And I think the COVID-19 pandemic has also brought in the question of inequality, or the existing question. It has just exacerbated it. There's a question on vaccine being man-made so that elites can sell it. Madam First Lady.
It seems to be COVID is man-made.
COVID is man-made, yes.
What they meant?
So I think there's, to me, those international conspiracy theories are detracting us from the fact that right now, in all of the hospitals these doctors are working, people are dying. Whether it was man-made, whether it came from a bat, whether it came from Mars. Right now, that virus is killing people, and there are solutions to stop it from killing people. We can do the philosophical debates later, but right now we don't want people to die. So there will be a review of what happened, what went wrong, what worked, what didn't work. But right now the focus is on reducing new infections. The issue about elites trying to sell a vaccine, in the Namibian context, they're making it as if we are the elites who have this plot. But in every country, this theory is there. So there must then be some kind of global elite WhatsApp group where everybody is making money, like some kind of pyramid scheme. I'm not in that WhatsApp group. I don't make a cent from a single vaccine. Certainly the pharmaceuticals are making lots of money. And that's the issue that can be talked about later. But right now, Blanche, honestly, I think we must answer questions as people ask them, which we're trying our best to do. But we've got so many questions and so little time that the philosophical ones need to be answered, but I'm not sure if we should belabor them too much. And people have Google. I mean, they asked us these questions on Facebook. If they are on Facebook, if they have Google, the answers are there.
I think one, just from with regards to the remarks on the vaccine manufacturers, I think also one should understand many of the vaccine manufacturers have actually given away or sold at a reduced price the patents to generic companies making these vaccines to enable the rest of the world to get it. So it's not like the companies are only behind profit. They are actually helping the rest of the world by having spent money on development, but sharing this knowledge with the generic companies to enable us to get access to these vaccines.
And then there's a question on why is the information on vaccines and COVID always changing? Something is wrong, and the person goes on to say, I'll rather wait and see.
That is medicine. With medicine, information changes. That's why the specialists are the ones, or the doctors are the ones up to date with what is going on, and we are the best ones to give you the information on the latest evidence and research out there.
And I think because, as the First Lady said, there's mutation. Mutation meaning that the virus keeps changing. What it is today, it might not be what it is tomorrow. And in a person's body, it changes. So therefore, it is a new thing, and allow science to do the research that they are saying. Allow Namibians also to open up. This is also an opportunity for us to venture into research within our own population. And then when it is now coming up, that is why every day we are learning something new because of the mutation and the vaccine. That is why we are saying it might work, it might not work. But right now we are saying it is working for majority of the people. So let us go with that.
And I think Dr. Bruwer, Dr. Hamunyela actually had a great point about it. Where it is true, the information is changing, and what we knew last year this time about the coronavirus and how people were being treated is different from what we know today. It is a new virus. It's called a novel coronavirus for a reason. So I think you had a great answer for that.
No, I think we're learning with regards to the virus and the effects of the virus. We're learning a lot, and the same will happen with regards to treatment. I mean, you'll remember us going through phases where certain medications ran out of stock because people thought that this medication is going to be the end of coronavirus. So as we're gaining experience, some of our data will change, but I think sort of short-term data that we have available currently, it's looking very good for the vaccine. Our main concern with things going forward and the vaccine is basically the mutations that we mentioned. Are our vaccines going to remain effective due to the potential slow rollout of the vaccinations at this stage? Do we give this virus the chance to mutate and skip the efficacy or change the efficacy of our vaccines? So those are things that's of real concern to me in the setting where I work currently. I mean, my colleagues overseas, living in Canada and working, people I studied with, saying they're going back to normal now because the populations are vaccinated. They don't see COVID in the hospitals anymore. They don't see the x-rays that I have to look at every day, and the patients lying on the ventilators anymore, which is a concern.
And at the risk of sounding repetitive, I think with any medicine, always you'll find new side effects. So, and this is a novel drug. So with all drugs, we'll find new side effects. Just to drive that point home, it will keep coming up as the years progress. And I think we should be reassured by what we were told about the populations in the UK and populations in Canada, because we know that the admission rates in the UK have gone down.
I think I was just add there that we also know with other vaccines that we have an idea as if we develop a vaccine like, so take for instance the Sinopharm virus, the Sinopharm vaccine, the virus that they modeled it on is a dead virus. So we know there's other hepatitis A vaccines which is modeled on a dead virus. There are other vaccines. Influenza vaccine is a dead virus. So we know how the vaccines work, and we will probably not get suddenly now realize there's this odd long-term side effect. I mean, we can't say with 100% certainty, but with extreme level of certainty we can say, knowing how vaccines work, knowing how we develop these vaccines, that the long-term risk of this is extremely low. What is more of concern is how long will it remain effective? That is my major question that I have with regards to the vaccination at this stage.
And the information will be shared. Well, let's move to the specific health questions. This person asking that he or she is about 2 months post-COVID, but still have a on and off chest pain with shortness of breath. Should they go for the shot, and which one, or if there's a waiting period, how long?
So I think there's two aspects of this. There is this entity called long COVID, which is also a field of pulmonology which is developing. We're finding a lot of patients having ongoing respiratory symptoms for a long period of time. That does not mean that they are infective anymore, so it's not like they've got the virus in them. They're just struggling with the long-term effects of that. I would definitely recommend that the person first consults a healthcare worker so that they can actually be physically examined to see what is, if there is a reason for this. But that in itself is not a contraindication to getting the vaccine. I think that's an important message. But one would like to have you checked out just to make sure that all the aspects that we can address have been fully addressed.
And there's a question on people suffering from conditions like the high blood pressure, kidney failure, Down syndrome, asthma and heart condition. Can they take the jabs, and which one?
So
Yes,
to answer the question in short, it would be the best advice that I could give to them is that they would have to go to see their general practitioner or a specialist in that regard, particularly if they're being treated for kidney failure, if they're being treated for any sort of genetic abnormality. It would be very important for them to see a doctor before they decide on which vaccine.
But if they're well controlled, for instance, the asthmatics who's well controlled, they can surely have the vaccine. The hypertensives, we know every patient when they go for the vaccination. When I went for the vaccination, you sit, they measure your blood pressure. They actually do it twice. Make sure that everything is well controlled. But if you're well controlled, chronic conditions in general aren't contraindications to getting the vaccine. But again, just make sure that you're controlled and consult your healthcare provider.
And I think also a very important point he's mentioning is that at all the vaccination areas, there is a nurse, there is a doctor that's there, and they are all really well trained. So at the first station, they look at your blood pressure, and they will ask you if you are known to have hypertension, are you on any treatment or any of the chronic illnesses. The onus is upon you to be honest. Also remember that some people get anxious when they are going for checkups. So could it be that high blood pressure is just at that moment because you're anxious? The person who's there monitoring you will then probably tell you to wait for a few minutes, and then we repeat it. Post the vaccination also, they check again your BP. So majority of the people with some of the comorbidities has taken the vaccine, and we are still okay. You just need to adhere to your chronic medication.
Mm-hmm. And let's go to testing. And I think this is a question that has also been sent to media practitioners quite a lot with regard to the testing. This person is asking, I was sent back from testing because I don't have symptoms, but was looking after someone with symptoms. What if I have COVID and spread it to others? Doctor.
I think the best answer to that would be, if you are asymptomatic, what we would like to do is we would like to take the burden off of our testing centers. So if you're asymptomatic and you're caring for somebody who has coronavirus disease, what we would recommend you do is to self-quarantine for 7 days. And then after this self-quarantine for 7 days, if you begin to become symptomatic, then it would be advisable for you to go for the test. Otherwise, we don't want to overburden our testing centers as we are already incapacitated.
And then the topical issue right now is the ivermectin, and the questions around it including, it looks like government wants us to die. Ivermectin is a cure, so why isn't it widely available? I think Dr. Bruwer, you can take that question.
I think, where's the camera? I think the important aspect that one has to understand is that, like our Medical Control Council have released a statement the other day, there is actually no evidence that ivermectin is the golden cure for coronavirus. As a matter of fact, most of the reliable, properly done studies in the field has actually showed no benefit when they look at ivermectin compared to a placebo drug. So there's actually very well done studies that show no effect. There are some small, poorly designed studies that showed potential benefit, and that's where this idea came from. And unfortunately, through the help of social media and the spread of misinformation, we're now sitting in a situation where for some reason people are believing that this drug is going to work. And I can assure you, in the hospital, if I can get a drug that can cure people and not have me having to sit with the families and explain to them why their loved one has passed, I would love to have this. But I'm seeing on a daily basis patients coming into a hospital having taken ivermectin, and they are severely sick, and I see patients dying after taking ivermectin. So it's for me, it's a very, very difficult situation to be in, because on the one hand, I know we've got the vaccine that can get us out of this trouble, and now we have to fight with regards to a drug that in practicality is not working and the evidence is not supporting it. I think if government had the opportunity to have evidence that it works properly and they can enroll it. I mean, it's a cheap drug. Why would we spend this amount of money and this amount of resources trying to vaccinate people if we can keep our hospitals sort of at normal levels of admission? It's really a difficult situation as a healthcare provider to be in, working on the front line.
Okay, but then again, there are questions around it saying, I've seen experts saying that this particular medicine works and has worked in many countries.
I think that it's very important that you have to look at that experts. I mean, I get the same questions. I mean, I had a discussion with a colleague of mine yesterday with regards to that. The reality is in medicine we believe in evidence. So we want our evidence to be published in a what we call peer-reviewed journal, preferably in a journal that has what we call high impact factor. So there's the reliable journals, if you want to call it that. In the field of internal medicine, I would mention a few: New England Journal of Medicine, the JAMA. There's a few. BMJ. Those type of journals are the reputable journals where we know throughout the course of history and through the development of medicine, these journals have been up to date with regards to doing studies well, etc. So what I always tell my colleagues is, go and look where is that evidence published. What you very often find is the data that are flying around in social media at the moment are published not in journals, very often not in peer-reviewed journals, often on the websites of the researchers themselves. They haven't been able to get them into these reputable journals because of a specific reason. The studies that were done weren't properly done. And we can't go and prescribe medication without proof, because we don't know what the effects of it might be. Because if a medication like ivermectin hasn't been properly studied, same going through the phase 1, phase 2, phase 3 trials, as I mentioned with the vaccines earlier, if it didn't go through that, then we don't know what the answers, what the effect of it is going to be. And the studies that went through those steps, that doesn't show benefit. So that's the only real answer I can give to that one has to stick to the evidence, otherwise what we have in medicine.
And there's a glaring contradiction in vaccines that have gone through all the steps, have been used over 2 billion people in the world with limited side effects. So there's a contradiction with somebody who says, I don't trust the vaccine, but I trust ivermectin. Or somebody who says, I'm not going to use the vaccine because I believe in prayer, but I'm going to trust ivermectin because there aren't more studies on ivermectin than there are on this vaccine, because the vaccine went through human trials. It went through all of the stages that it had to go through. It's been used over 2 billion people in the world. So its side effects are known. The side effects that have manifested, over 2 billion people. The same can't be said for this. So I'm not sure about saying I don't trust this one that has been rigorously tested, but I'm going to try for this one.
There's a question, I think, Dr. Ellitson, have you dealt with the request for a patient to use ivermectin? Because there's a question stating that I know someone who used it and has recovered.
So I, on a daily basis, get barraged with this question. And my answer is the press release by the Namibia Medicines Regulatory Council, which is we need to have, and it comes back to the point that Dr. Bruwer brought out, we need robust evidence, and we just don't have robust evidence for ivermectin.
So the next batch of questions are around anxiety and grief. With death rates going up, there's a question saying, I'm surrounded by so much loss and grief each and every day. I'm hearing more and more people who have died. How do I manage my anxiety? Dr. Hamunyela, you may start.
Okay, yeah, that is the important area now when it comes to COVID and mental health. And that is where we need to invest now. Definitely people are dying. Definitely they're dying from the COVID itself. They're dying because of the effect the COVID has on them. But now the important thing is, how are they dealing with this death and loss in their own families? You know, every day when you are hearing, this actually raises a lot of stress. Now, for example, a person who already suffers from anxiety, during this particular time period, the anxiety is 3 times higher than it normally is. So also take into cognizance that the anxiety symptoms are similar to the COVID symptoms. The only difference is that they do not have a fever. With anxiety, they don't have a fever. So you keep going and keep going. Now, the more you are thinking about it, the more your anxiety goes up. So we are saying, what are you going to do now? Even though we are saying you're isolating yourself, we're saying isolation is not as good for a person with anxiety, but you have to make your environment comfortable, conducive to you. Talk to somebody, even if it is, on telephone, on Skype, on WhatsApp, call somebody. But we are saying talk to somebody who has a positive impact on you. Don't indulge in people who are bringing you down or feeding you with negative things, because this is also going to feed your anxiety. Apart from anxiety, we also saying in this time period, depression also comes in. And then substance also comes in because of the rules and regulations. We are not able to socialize. We are not able to be with our family. So therefore, the one thing we are doing is we are overindulging in the substance to fill that void and to fill the anxiety. So we are saying we have specialists in that area. We call them the behavioral science section. We need to involve people in that area, which will include your psychologist, will include psychiatrists, will include social workers, occupational therapists, and then physiotherapists also. We need them because after effect of this, like Dr. Bruwer said, they will have problems with the lungs, even the brain, even walking and stuff. So if you don't involve all this multidisciplinary team, the person, you go very down, and then suicide as the consequences of that. So we need to allow our people to grieve, and we are saying there are a lot of stages for grieving. There are 5 stages. We have to go through them. If you are stuck at one point, obviously you are not going to move on, and you will have a lot of mental issues. So now is the time we are saying invest in that. Be comfortable to say, I have a shrink. People have a stigma against that, and it's a problem, So it's like we all have psychologists, we all have psychiatrists. In as much as we are psychiatrists, we also have where you go debrief and de-traumatize yourself about that.
One one of the big problems with loss is that you cannot greet. You cannot gather around your loved one's bed, say proper goodbye. I know you've allowed some patients to come into the unit to grieve to greet the loved ones, and also the funerals, because it cannot be held as one would usually want to support each other. That's really difficult, and we have to make sure and follow up patients once loved ones has died, whether they are going through the grief process. So when you look at the research with regards to SARS and MERS, the previous infections, which wasn't as severe as what has hit the world now, the most prominent psychiatric sequelae was anxiety, depression, insomnia, substance abuse, post-traumatic stress disorder, and then the grief. So these are the things we need to look at, and suicide. What I try and tell my patients who sits with me in the consulting rooms, and also what I can advise to people here to manage your anxiety and to manage your distress, is think of what can you control, and then control that. One of that is vaccination. So if you know, and I can tell my patients, I'm vaccinated. So yes, we wear a mask, we social distance, but I'm actually cool. I'm not too stressed that I'm going to get corona, and if I do get it, it's definitely not going to be bad. So do what you can do to control your anxiety. So then you can tell yourself, oh, I'm okay, I'm vaccinated. My mother is vaccinated, so we are going to be okay. Control keeping your immune system healthy. How do we do that? You exercise. You take enough fluids. Stay away from drugs and alcohol. Get some sunshine. We live in a country with a lot of lovely outside fresh air and sunshine. Eat healthy. Speak to somebody when you are feeling stressed. And then stay away from social media. Put off the TV, put away your phone. Rather go and sit and spend time with your family, and let's speak about our dreams, our fears, our hopes, rather than sitting with Facebook and reading all these conspiracies. So that's what I would tell patients. And if you do feel that you're really struggling, then speak to people. You have trauma counselors, psychologists, psychiatrists. People are doing virtual consultations these days, so you don't even have to expose yourself to COVID to consult with somebody.
Does that not speak to the question of accessibility? How accessible are these services for the general public out there? I think Dr. Ellitson, you can also come in there.
So at the moment, with regards, if I can only speak with regards to the state facilities. So at the moment, with regards to state practice, we are a little bit incapacitated, but that doesn't mean that we have completely stopped the services that we usually offer to our patients. So I think that generally speaking, we have hotlines that are available for our patients, particularly if you feel that you're overwhelmed by social media, that you feel that you're overwhelmed by what has happened in your family. You may have lost a close loved one. I think the mental health center is still available, and it's still open.
Yeah, I can add on that. The mental health center is the only center that, compared to other centers that have specific days. Ideally, we said Monday and Wednesdays are our outpatient days, meaning the other 3 days we are doing inpatients and the forensic observation. But now at the moment, like today is Wednesday, our OPD was packed up to outside.
What's an OPD?
Outpatient department for psychiatry was packed up to outside. We were distancing inside and outside, but it is still there. It was there. Now we are very, very short-staffed. We are working with only 3 psychiatrists for the state, of which 2 of us does private in the afternoon. Then our medical officers at the moment, we only have 3 that are on site, and then every day we reach the number of 100, and we have to manage those patients because they are already vulnerable because of the mental illness, and then the anxiety itself is brought on even being on in the COVID. So you do not expect our patients to understand. Do you understand? So we really try to do that. But apart from that, the same psychiatrists and the same people who are working at the mental hospital are the ones that are on call 24 hours for psychosocial support group, of which the numbers we have given at different times, but I can still give it. which is 081 160 2144 or 3. So you'll either speak to a psychiatrist, psychologist, all those people that work there. So what we request for the community at large is also to bear with us, to know that we are really few. And even in the private, there you make consultations. But overall in Namibia, we are saying we are a handful. We don't reach the number of 10. So for a population of 2.45, how many of us